Hi there, I'm Dr. Mark J. Spurbeck, chiropractic orthopedist here in Cincinnati, Ohio. Today I'd like to speak about Ehlers-Danlos syndrome and chiropractic. A lot of patients and doctors think that Ehlers-Danlos syndrome patients should not be adjusted. And it stands to reason. It makes a lot of sense when you think about what the disease actually is. The ligaments are lax. There's too much motion in the joints. Why would I want to use a modality that involves putting more motion into a joint that already moves too much? And I get that. But I'm here to tell you that EDS patients respond very well to the right chiropractic adjustments. Every EDS patient is different. We take that into consideration when we perform our chiropractic adjustments, and so what I'd like to spend some time talking to you about in the next several videos is why and when chiropractic care is appropriate for an EDS patient. First off, we need to understand something about any joint in the body. And a joint is basically two cartilaginous surfaces pushed together with soft tissue, a capsule, fluid inside that hold them together. Now, in normal forces being applied to a joint, that joint will be stressed in one direction or another direction or another direction. Any direction that joint is stressed in, it should bounce back to the centrality of its motion. In an EDS patient who has excessively lax ligaments, that joint can be pushed into a position where it becomes stuck and locked, and it will not bounce back to that normal centrality of motion. Here it becomes extremely painful. There's inflammation, muscle spasms, even nerve irritation causing numbness and tingling down into the arms, legs, hands, or feet. The chiropractor's job is to find those areas and gently coax those joints back into its normal juxtaposition without doing it so excessively forceful that it goes into another position where it gets stuck, which is where they can run into trouble. So it's a very gentle coaxing into that direction to bounce that back. And when that's done, the EDS patient gets immediate relief, tremendous relief of the symptoms that they've been suffering from.